I'm a primary care doctor. I'm here with my colleagues with the Right Care Alliance. We're a group of doctors, patients, nurses, advocates, people who care about price gouging and unfair access to the medical care and the drugs that we need. We were here just months ago at Sanofi. We were here to grieve the deaths of 6 young people who died way too young of preventable deaths because they couldn't afford the insulin they needed to stay alive. We grieved the deaths of Megan, Micah, Jesse, Alec, Antavia, and Shane. Now we're back, just 4 months later, to grieve the deaths of 4 more young people who died in their 20s, way too young.
Jesse Cher Radcliffe, age 21, died June 28, 2019. Jesse worked 2 jobs to support himself and was working on becoming an electrician. Unable to fill prescriptions until the next payday, he was hospitalized in April with diabetic ketoacidosis. In June, 2 days after he had last seen his family, he called in sick to work. He was found dead the next day. He died because he could not afford his insulin. Jada Rene Lewis, age 24, died June 22, 2019. A type 1 diabetic since age 7, Jada Lewis found herself faced with a terrible choice this year: pay her rent or the $300 cost of insulin. After rationing landed her in the hospital for a week in June, she returned home in apparent good spirits, but a week later she was dead. She died because she could not afford her insulin. Josh Wilkerson, age 27, died June 14, 2019. Josh and his fiancée Rose Waters both had type 1 diabetes. Josh managed a dog kennel and was uninsured, and to help save for their wedding and new home, they decided to try using Relion, an older insulin that they could purchase cheaply at Walmart. For Joshua, the insulin proved incompatible with his diabetes. During an overnight shift at the kennel, his blood sugar skyrocketed and he slipped into a coma, dying several days later. He died because he could not afford his insulin. Kayla Davis, age 28, died June 5, 2019. Kayla submitted a prescription for insulin to her pharmacy, but could not be filled until her doctor's office submitted the forms necessary to get it covered by Medicaid. She rationed the insulin she had left. Over the next week, she got sicker and sicker until she died from ketoacidosis. The approval for insulin came through the next day. She died because she could not afford her insulin. My name is Mishy Katz. I am 30 years old. I've been type 1 since age 11. I enjoy knitting, binge watching Netflix, and spending time with my husband, our cats, and dog. I also stay up at night worrying about the cost of our health care. We have struggled to afford the insulin that keeps me alive. This has prevented us from growing our family and from many other things that people our age should be enjoying and doing. Like many diabetics, when I am capable, I've shared my surplus of insulin with others who need it. This practice is illegal, but overcharging people to death is not. Sanofi and their ilk have our blood on their hands. Reading the growing list of names of fellow diabetic brothers and sisters who've been killed is difficult. I am petrified, and I don't want to be next.
My name is Alan Myers. I'm a pediatrician. The deaths we've just heard about from insulin rationing were entirely preventable. And here in the United States, the richest country in the history of the world, that is entirely unacceptable. Our demand is that there be no more deaths from insulin rationing in the United States ever. We are the Right Care Alliance. Please join us. We are here to stay, and we're not going away until this problem is fixed.
No more deaths.
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 No more deaths. Sanofi, you can't hide. We can see your greedy side.
Sanofi, you can't hide. We can see your greedy side. Sanofi, you can't hide. We can see your greedy side.
Okay. 3, 2, 1. I'm diabetic. I need insulin, but my insurance is in a tailspin. I lost my job and pay out of pocket. Pharma don't care for you and me. Went to the drugstore, showed my prescription. I